Good afternoon, friends. It is Friday afternoon, going to be 3 o'clock. I'm Alakshmi, Dean Health Professions Education. On behalf of Scientific Society of Aarupadai, our Constituent College of Vinayaka Mission Research Foundation, we welcome you for our ongoing webinar series, Forefront of Future Frontiers. Friends, just a reminder, we are in series 4, that is, we are exploring the four frontiers in research, and we have got, this is episode number 21 of our FFF webinars. And today we have with us a very eminent speaker, Dr. Mohan, who is the director of Dr. Mohan's Diabetology Hospital, and he is also the chief diabetes research at Madras Diabetes Research Foundation. Last week, just to recap, we had Dr. Vishwamohan Katoch, and this week we have Dr. Vishwanathan Mohan. So that is what we had. We had eminent speakers spanning across the continents. We had people talking about COVID and public health, what are the similarities and differences. That was the speaker from Australia. We had talked about drug molecules, how we can repurpose and use them during these trials. A speaker from in Washington, USA. We had speakers talking about how simulation can be the answer to healthcare training in this thing. So we had spanned a wide variety of topics during this session. So I would request our Dean, Professor Premnath Kotur sir, to welcome the people and then to introduce the guest speaker. Over to you, Dr. Kotur.
Yeah, thank you, Professor Mahalakshmi. Very good afternoon, my friends. I feel honored and feel privileged to welcome speaker Padma Shri V. Mohan and all the participants. I welcome all of you on behalf of our university at large, on behalf of our management, on behalf of our chancellor. And you will be speaking on a very important, relevant, and much needed topic, that is the diabetes and COVID-19. What is the link you'll be exploring? And certainly I'd like to say one or two words as the head of the institution about our scientific society, this FFF platform created by the Vibrant Scientific Society of AVMC is now more than 6 months old. In this short span of 6 months, we have already hosted more than 20 eminent scholars, scientists, and academicians from all the continents, and they have shared their experience and expertise on this platform on their focal areas of interest and research. And that is aimed at for the entire benefit of the medical fraternity at large. And this platform, I'm proud to say, that has established so much of credibility that the professionals are waiting eagerly for Fridays to looking forward to have this academic feast. And it is evident from the number of participants and the feedbacks we got. And prior to that, the one or two thoughts I must tell about Professor Mohan's topic, which two things. One is diabetes, another one is COVID. The world, and hosting more than having more than 77 million, 7.5, 8 crore of diabetic patients, and which the number is going to be doubled, we all know, in the next 25 years. And as regards the COVID is concerned, India is number 1 now, number of people affected, and number of the deaths, of course, we are very less. And ever since the WHO declared the this COVID as pandemic on March 11th, the observation is the patients having diabetes are having a poor prognosis. And that is this poor prognosis is because of the diabetes as per se, or concomitant risk factors and comorbidities those exist. This I'm sure certainly will be illustrated by Dr. Mohan. And one more thought, I already suddenly that came to my mind is like, this is comparable to smoking and cancer. Like that, all the patients who have got a poor prognosis because of COVID are diabetics, but all diabetics need not suffer from COVID. This we used to have the campaign. So with this, that means there is some definitely, in spite of this, all these things, the link exists between the two, but the link is complex, link is multifactorial, and there is a definite link. We have a world authority on diabetes, Mr. Mohan, who will be illustrating this link. Now I have a pleasant duty. Malaki, can you mute?
Sir,
Some echoes.
yeah. Please go ahead.
It's my honor to introduce Padmashri Mohan. Yeah, next one. And who is the chief diabetologist and the chairman of the Dr. Mohan's Diabetes Specialty Center at Chennai. And it is a center of excellence as declared by the International Diabetic Federation. And Mohan oversees 48 diabetic centers, 8 states, and has over magnificent number, 500,000, that is 5 lakh registered diabetics. And he is the president of the Madras Diabetic Research Foundation. And it is one of the, it is the Asia's largest standalone diabetic research center. I had an opportunity to visit MDRF almost 6-8 years back. I'll say it is a research factory. And I saw at one stage, there was at that time, I remember correctly, there were 21 PhD scholars, they were going the PhD over there. And I also have seen the research capacity building that is undertaken from there. They conduct the research methodology workshop. In fact, they visited my university. So I really distinctly remember how they deliberated these sessions. And Dr. Mohan has more than 1,300 scientific publications, papers, which include original articles, which include reviews, editorials, and chapters in the books. And it is proud to say that he has got 1,26,000 citations. It is amazing. I always expressed, even in my VNI, about what a person can do in a minimum possible time. Swiftness versus accuracy is the living example. Next slide, madam. Next one, yeah. And Dr. Mohan is an educator too. He was as a adjunct professor emeritus in our university earlier, and with what passion he used to teach. He was so much constrained for time, but in spite of that, he used to engage the classes within that limited period whenever he used to visit us. And there has been a number of awards. He has 180 awards to his credit, which includes 2 prestigious awards, BC Roy National Award, and another one is the Ambedkar Centenary Award for highest award by ICMR, highest award for biomedical research. Professor Mohan has a unique distinction of being the first Indian to receive the Harold Rifkin Distinguished International Service Award, awarded by American Diabetic Association. And recently he's been awarded the Fellowship of the Royal Society of Edinburgh. And only very few Indians have this for his recognition of his extensive contribution in the field of diabetes. And I'm sure many more will be in the way he is aggressively addressing the issues. And even I was the chairperson of the National Committee, that is Research Committee. Next one. And in the year 2000, in recognition of his services, Dr. Mohan was awarded the Padma Shri Award by the Honorable President of India in recognition of his services in the year 2012. this is, it is a CV, etc. is quite exhaustive, Then I will try to be as much as brief as possible. And I will request Professor Mohan to elucidate the link between these two things, one communicable disease and another non-communicable disease.
Yeah. Thank you very much, sir, for that introduction. And some few announcements. Please keep your audio muted and video on so that the sound quality is good for everybody. And also, we would like to inform all the participants that this session is being recorded because we would like to use this session for future viewing by other people. So we are transmitting it live in the YouTube as well as recording it. Over to you, Dr. Mohan. You are now the presenter.
Hello?
Yes, sir.
You can see my slide? The slides, can you see?
Not yet, sir.
Oh, you can't see my slides. Okay, let me, because you switched it off. So let me try this one.
Have to
now,
share, sir.
Now, does it? Now, can you see?
Not yet.
Then not yet. I'll have to again go and get this because I think when you switched it off, it must have gone. Let me say share and then try it again.
Yeah.
Now, and now it's going?
Yeah.
Yes.
Okay, wonderful.
Yeah. Okay.
All right. So as I was saying, it's a great pleasure to reconnect with Professor Kotur. I was always very impressed by his dynamism. And he mentioned that, I found time to go to the Dr. Devaraja's Medical College and University where he was the Vice Chancellor. And the reason for that is his passion. He visited us, he was very serious about research. And whichever institution he has touched, he has made it blossom. So I think all of you, the staff and students, are very fortunate at AVMC and VMRF to have Professor Kotur as your dean now, and I'm sure he will take it to very great heights in the years to come. I've already made a promise to him that at some point when COVID settles, I will try to come and visit your institution, try to establish further links with your institution. I like this name, the Triple F, because the forefront of future frontiers sounds so futuristic. And I was amazed that to see the quality of the people you're able to attract for these programs. Professor Vishwa Mohan Kato, which was a former DG of ICMR and a very important person who actually supported our INDIAB study, and I know him very well. And so it's a great honor, of course, to be here with you. I'm going to plunge straight into the subject of diabetes and COVID. What is the link in the interest of time? Once again, thanking Professor Kotur, Dr. Mahalakshmi, and all your staff and professors and the students. I see a large number of students who have come for this. Very good, but that is the way you have to learn. Now, I have no conflict of interest to declare. This is a very general talk that I'm going to give. I'm going to give certain questions and then, discuss the link between diabetes and COVID-19. As Professor Kotur said, diabetes is such a big problem in India, and COVID has also become a large problem in India, and there could be an overlap between these two. So the first question people ask is, are people with diabetes more likely to get COVID-19? In fact, many of my patients ring me and say, now that I'm already diabetic, I'll definitely die, isn't it? I'm going to get COVID and definitely I'm going to die. So should I write my will and just wait to pass away, So I tell them, see, it's not as bad as that. And I'll show you today that, of course, uncontrolled diabetes is you're playing with fire. But then, are you more likely to get COVID-19? Why would you get more COVID-19 if you sit at home? I mean, COVID is not going to come like like a drone finding where are the diabetics, let me go and attack them. It's not like that. If you expose yourself to someone, you may get COVID-19. So there is no problem that people with diabetes will just get COVID-19 more. But if you get it, and if your diabetes is uncontrolled, then you can have worse outcomes. So that is the next question. Will they develop more severe form of COVID-19? The answer is actually, if your diabetes is uncontrolled, yes. We have done some modeling studies looking at HbA1c to see at which HbA1c the risk actually increases. Now, you know that the normal HbA1c is 5.6 for a non-diabetic person. 5.6 to 6.4 is a pre-diabetic condition. And below 7 is considered fairly good control. Actually, up to 8 or 8.5, the risk doesn't increase. The risk doesn't increase of getting very bad, outcomes with COVID. But above 8.5, the risk dramatically increases. If you are having an A1C of 9, 10, 11 and all that, you better get your A1C and your sugars under control. Because people with type 2 diabetes are also older. Many people with type 2 diabetes are 50, 60, 70, 80 and so on. So age itself is one prognostic factor. And now diabetes becomes the second prognostic factor. They may also have hypertension. They may also have heart disease. They may also have some lung problem. So that is why the outcomes are not very good. Now, what are the mechanisms where diabetes increase the risk of severity of COVID-19? I already mentioned to you, the age itself is one, hyperglycemia is another one, associated comorbidities. But there are also immunological factors. For example, there is a higher affinity cellular binding and efficient virus entry. Suppose that it's supposed to be related to the ACE2 receptor and so on. But there is theory that the virus can enter a little bit more easily. And then there's also decreased viral clearance, diminished T cell function. We are beginning to realize that T cells are very, very important. And even if you don't have antibodies, if you have good T cell function, then that is enough. The killer T cells will go and kill the virus. But if you don't have that, then, and that's what happens in people with diabetes, then there's increased susceptibility to hyperinflammation and a mount of severe hyperinflammation response and a cytokine storm, which is what makes the prognosis bad. Now, these are early data from published from the world, many of them from China, some from USA, which if you look at, what is the prevalence of diabetes in those who have severe COVID and non-severe COVID? The non-severe COVID is in a darker color here, and then the severe COVID is in the lighter gray color here. So you can see if you just look at the percentage of diabetic people among the severe COVID, it is 17%, 19%, 20%, 25%, and so on at 32%. As compared to the non-severe form, there is only 4 or 5%. So among those who have worse disease, there is a lot of diabetes because those people are the uncontrolled ones. If you look at it in another way, and if you look at the survivors versus the non-survivors, if you look at the survivors, about 10% have diabetes. But you look at the non-survivors, between 25 to 30% have diabetes. Again, telling you that uncontrolled diabetes is associated with mortality. Now, this is early data again from China, where if you look at the overall mortality, it is reported to be 2%. That means out of every 100, 2 may die. We now know it's actually much lower. It's probably 0.5 or 0.6% overall. But it's related to many factors, and diabetes is one. So if you have diabetes, the fatality rate increases to 7%. So it's actually 3 times higher if you have diabetes. And again, I'm saying uncontrolled diabetes. Now, this is a cytokine storm I'm talking to you about. The SARS-CoV-2 virus enters into the respiratory tract. And if you have a robust immune function, if your macrophage activity and all your other immune cells are very good, they'll go and kill the virus. So when they kill the virus, it will die. So you will get a cold or a cough, or you may not get anything, and then it will just subside. But suppose your immunity is weak. It's like a country having a very weak army. Suppose your army is very weak. The neighboring country will just march into your country and then take take control of your country. Similarly, like this is the enemy, and this is entering. There is no army here. Your defense mechanism is very weak. So what happens? It will enter. It will produce a severe reaction there. Then that will produce, a kind of a cytokine storm, and that is believed to be mediated by the CD4 T lymphocytes. Now these can produce what is called as a hyperinflammatory response or a cytokine storm. Once the cytokine storm comes, it's like a bomb exploding inside the body, okay? And if that happens, every organ gets affected, multi-organ failure. So your liver can get affected, kidney can get affected, heart can get affected, lungs, of course, can get affected, brain can get affected. Today there was in the paper saying strokes can occur due to this. So it's once it enters the body, there's no saying where it will go. And it's not the virus which is going. It is inflammatory response is going. Virus will do its job and then stop there. But then the body is so weak that people succumb to it. Now, the question is, are people with type 1 diabetes also more prone or carry a worse prognosis? When I started giving these talks on COVID and diabetes about 3 or 4 months ago, I used to say, no, they will not get because they are younger, they don't have heart hypertension, age is less, and they have pure glucose problem only, they don't have metabolic syndrome, so it's very unlikely. Then one report came from Britain, which showed that type 1s actually do worse than type 2s. I was very surprised. And then I'm in many international committees. So we are all sad. The Germans didn't agree, the Italians didn't agree, the Americans didn't agree. But these British fellows went on saying, no, they do worse. Then we found out that, the experience in Italy, Germany is opposite. This is a slide prepared at that time. Then the study really got published. When it got published, they are talking about 75-year-old type 1s. Okay. So these are not the children with type 1. When they first published, we thought it's children are talking about or young adults. They are talking about old people who have had type 1 diabetes for 50 years, 60 years. Naturally, because of age, their immunity and all that is very poor. So the short answer is type 1 diabetes seems to be a little better. But already I know through the newspapers of at least 2 or 3 deaths in India of 19-year-olds and 18-year-olds with type 1. So you cannot take any diabetes for granted. You cannot say, no, you won't get it. Everybody must control their diabetes well. Now, what should people with diabetes do to prevent COVID-19? The general principles are the same. I mean, COVID is COVID, whether it's for diabetic or non-diabetic. So the general principles, first tell patients not to panic, and I'll come back to this quite strongly towards the end, because I believe that a lot of panic and being, created for no reason at all. We're giving too much importance to COVID, in my opinion. Okay. So practice the same principles of prevention: social distancing, frequent hand washing. Wearing a mask is very, 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 very important. Without a mask, if you go out without a mask anywhere, you're asking for trouble. So wear a mask. Don't look at your vanity and don't look at your beauty and don't look at the beauty of the mask and don't look at all that. Life is more important. We can do all that next year, This year, why are you looking at all that? Everybody is wearing a mask, So whole world has become like that. We are not the only people wearing. So don't look at all those things. Of course, good respiratory etiquette, something we learned after this came. Coughing into your hands or your elbow, because then your hands don't get soil and then you don't go and touch somewhere. Also in the clothes, the virus doesn't stay for very long. Okay. Fomite infection is almost unheard of. People think you touch a table, you will get COVID. You won't. The virus cannot last. In our temperature, it will not last. But from the hands, you can go and touch everyone, your own body, you touch somebody else. That is how it really spreads. Now, what extra precautions could people with diabetes take to prevent COVID? Number one, most important, underline it many times, control diabetes well. Without that, you're talking nonsense. If you don't control diabetes well, whatever else you do, it's of no use. For that, you must know whether your diabetes is under control. So check your sugars often to ensure control. In the end, I'll show you some in a paper which we published on this topic about 1 or 2 months ago. Then eating healthy. I'm going to dwell on this. I'm not wasting time in this slide, but I'm going to come back to it. Eating healthy is very important. Exercise is very important. Pranayama is very important because it helps to reduce stress and improve lung function. These things I'm going to discuss in detail. Okay. Good nutrition practice means several things. Number one, you must eat well. Starving yourself, this is not the time to try to attempt weight loss now. Are you going to lose weight in the next 4 weeks? You're not going to do it. If you starve yourself now, your immunity will go down. Start exercising, cut down some carbs, you can do all that. But this is not the time to kind of starve yourself, because you need energy, you need immunity. And for that, you need good nutrition. Eat slowly. Only then what you eat gets digested. Eat on time. If you don't eat on time, you're stressing out your body. Eat right, and I'll talk about that. And have a complete balanced nutrition. Last two, I'm going to talk about. Okay. Now, I made a video about 3 months ago. One of my, my marketing head, she came and told me, sir, this is about 3-4 months ago. People are not yet, now everybody I see is taking vitamin C and zinc and this, and they think that is immunity. Okay. So she came and she brought one camera and she said, sir, can you record something? And, on immunity, can you just record? Most of the time I talk extempore. So I said, okay, record, I said. And so I just on the top of my head, I said, these 5 things are very important. 5 tips for improving immunity: diet, exercise, stress, sleep well, and control chronic conditions. And that video is about 4 minutes long. Okay, 3 to 4 minutes long. I don't know how it went viral. It has gone completely viral. There's nobody I know has not seen that video. I'm sure many of you would have seen it because through WhatsApp it's going up and down, all over the world. I'm getting the video back to me. It's been coming. Actually, I put it on YouTube. And YouTube, there are only about 30,000 or 40,000 views. But I'm sure it's gone to millions of views because everybody I know has seen this video. I'm sure some of you also would have seen it. So these are the 5 points which I want to talk about today because I think each of them are very important. Immunonutrition. I just mentioned that diet is linked to nutrition. Now, there are certain things about nutrition you cannot change. For example, your age, gender, genetics, early life events. These things you cannot change. Hormonal status, to some extent, you cannot change. But look at this. Diet, gut microbiota, obesity, alcohol, smoking, lack of exercise, stress, all these. And somebody asked me about vaccination in the chat box when I was just beginning to talk. I'll talk about that. I have a slide on that. All these are controllable. So a lot of it, actually, you can control and make your nutrition and your immunity better. Now, I said these: eat well, eat slowly, eat on time, eat right, and have complete balanced nutrition. Okay. Now, what about diet and immunity? Now, diet is very important, and I said, how can you improve this immunity through diet? Each one of them is important. That's the thing. So, on my video, what I say is, don't think taking a zinc capsule is going to give you immunity. Or, we are kabasur kudineer. If you drink one thing in that, you're going to get immunity. It doesn't happen that way. I hope life was so simple. It's not so simple, unfortunately. So this immunity can be improved, number one, by reducing your carbohydrate intake. This is the villain. This is the killer. Some of you might have seen my paper on rice and diabetes, was published about a week ago. It's been making really big news. All television channels, newspapers, all have been writing. It's a study of 132,000 people in 21 countries followed for 10 years. It's the world's largest study, where I'm showing directly that white rice intake is linked to diabetes. It's kind of proven now on that study. It's a pure study. So if you reduce your carbohydrate intake, I'm not saying stop it. Don't stop it. That will become keto diet, which is very bad for you. You reduce it from what you're taking, you take half of it. Okay, that is rice and chapati. This is what leads to inflammation. This is what leads to insulin resistance. If you reduce that and substitute it with large amounts of vegetables, especially green leafy vegetables, and protein, your diet is the healthiest diet you can get. Protein for non-vegetarians is easy. It can come from fish, chicken, white of the egg. For vegetarians, the protein source will be mostly legumes and pulses. Bengal gram, green gram, black gram, soya, mushroom, the sundal, what we call it. That is very, very, very good. Of course, milk also will give you some protein. Egg white is fantastic. You can take egg white, it's great. Then there are healthy fats, which are also very good for immunity. Nuts and seeds, flax seeds, chia seeds, pumpkin seeds, anything you want. Any nuts you want, including cashew nut. 2 years ago, we published a major paper in Journal of Nutrition on cashew. It's a randomized clinical trial where we showed that cashew is not actually bad. Cashew is actually good. It reduced the pressure. It increased the HDL cholesterol, did not increase the LDL cholesterol, no effect on blood sugar, and no effect on weight if you adjust the calories. Fantastic study, very well quoted, Journal of Nutrition in the American Journal. So nuts, any nuts are good. Even your groundnuts are good, okay? Because they contain monounsaturated fats like groundnut oil, gingerly oil, mustard oil. These are all very good to increase your HDL cholesterol. Now, this is a very important slide. If you forget everything else from this talk, don't forget this one picture, okay? Now, the way we eat is, wherever you eat, if you invite me there also, what we'll do is we'll be given a plate, then there'll be a lot of food kept there. First thing we'll go and put all the rice onto that, okay? Then we'll eat sambar. Then we'll put one more rice. Then we'll have rasam. Then we'll put one more rice. And each time we'll eat a mountain of rice. The third time it will be either curd or buttermilk or something. So 3 times over, okay? If you do that, your carb count is going to go very, very, very high. And that's why we put on weight. That's why we get a belly. That's why we get metabolic syndrome. That's why we get diabetes. The way we have to start eating as Indians is, when you get a plate, look for the vegetables. Where is the vegetable? Let me first put that. Fill your plate half with vegetable. If you take this half vegetable, already half your stomach is full, okay? And they are loaded with nutrients, with iron, with minerals, with B complex, with B12, with whatever you want, folate. Everything will come from here. Carotenoids, flavonoids, you name it, it will come. Reserve 1/4 of your plate for the protein. Ask your question for breakfast, lunch, and dinner, where is my protein? Start asking that question from today. Where is my protein? If you're a vegetarian, you can look for Bengal gram, green gram, black gram, soya, mushroom, whatever. all that you can fill up. If you're a non-vegetarian, lunch and dinner, you can have a piece of chicken or something. In the morning, you can have the egg white. So you're going to get your protein with every meal. That's the only way you can raise your protein content about 20%. The last quarter is reserved for your rice or chapati. Believe me, take it in spoons. Don't take in big ladles of rice. You don't need it. Last 5 months, 4 months, I've lost about 5 to 6 kilograms in weight because I started doing this, Not that I was at any time overweight, but I felt that, a little bit more, about 4 5 kilos, if I lose, it'll be good. Completely, I lost 4 5 kilos. Almost every metabolic, I didn't have any metabolic disorder before that. But even the borderline ones which I had all crashed to normal. Just yesterday I did my blood test, everything has come to normal. Okay. That's the power of cutting the carbs. But don't make it zero. Don't remove that portion. That is where you go wrong with trying keto diet, paleo diet, all these diets, Atkins diet, because then the rest of it will be filled up completely with fat, which is not good again. Okay. Little bit of carbs you need for the energy. You need a little bit of carb, but that must be 1/4 of the portion or half of the portion that you are taking. If you do that, this is the healthiest diet. So just as one figure, if you remember, your immunity will go up. Okay. What about which fruits and which vegetables to take? Doesn't matter which. Take all colors. Take white, take green, take red, take yellow, take orange, take everything. Each one contains one carotenoid, one flavonoid, one B complex, one something else. It'll give you everything. It's impossible to remember for a layman to remember all these things. But don't forget the green leafy vegetables. That is one of the backbone. We throw it away. When you see a leaf, you throw it away. Don't throw it away. Eat it. That is the one which is going to give you nutrition. That is why Indians are weak, because we don't eat this. Chinese eat a lot of salads. They may eat little rice, but they eat a lot of salad. They eat a lot of protein. We don't. That's why all the Olympic medals they win. We don't win. Okay. That's because their health is, they may take rice, but they eat less of it. We eat only rice or only chapati because we think that is our main meal. We are making a mistake for many, many years now. Change it today. Fruits also can be of different colors. If you don't have diabetes, you can have as many fruits as you want. You want 4, 5 a day, take it. If you have diabetes, fruits contain fructose. You must take 1 fruit a day or 2 fruits a day. That also you can change. You can take one green, pear you can take, or papaya you can take, or you can take, grapes, or you can take orange, or you can take anything you want. Even mango you can take. If you're going to really cut down, mango is bad because sugar will go up. Definitely. If you're going to eat your usual carbs and then you take mango, your sugar will go to 400. But if you're going to cut your rice totally, you can take mango a little bit because that's also carbs only. There's nothing very different. It's only because of the extra carbs that you take that it's a problem. This is a kind of repetition of this. I just want to show you that this side of it. Even when I said chicken, I didn't mean deep fried chicken like this. This is full of trans fats. The chicken must be healthy. Boiled chicken or grilled chicken, something like that. Not deep fried chicken, not like this. Similarly, rava, maida and all that come under the 5 white poisons. Sugar, milk, maida, salt, and they're all the 5 white poisons of the thing. So too much of this is also not good. Similarly, all these junk foods that we eat, all the pizzas and the burgers and filled with fat, filled with salt, filled with calories. People don't know what is the value of one caloric value of one pizza. One large pizza, 1,200 calories. That's your whole meal for the whole day. So what happens is people will take half a pizza they'll take, and then they'll say, "Where's my dinner?" Your dinner for 3 days already over. Okay. So don't get, so you're going to eat Indian food, stick to that. If you're going to eat that one small piece of it, that's your dinner. Okay. You're not going to get anything else. If you train yourself like that, remember rat experiments, mice experiments, and now human experiments have shown the less you eat, the longer you live. And the healthier you are. It's the exact opposite of what we think. Okay. Now, 3 things. These 3 like buzzwords, everybody, vitamin C, vitamin D, zinc. Every prescription of mine, every patient will be taking this. Well, it's good to take all of them, but vitamin C you can get from gooseberry, from orange, sathukudi, lime juice. Why do you need to take vitamin C supplement? It's acidic. It'll start producing gastritis for you. If you really need it, you have a deficiency, you take it. Otherwise, you don't have to keep taking vitamin C. You can take it from your food. Vitamin D, on the other hand, you cannot get from food. Which food is going to give you? A few foods will give you our egg yolk, fatty fish, and a few others. If they're supplemented, normally you don't get it. You get it from sunlight. And in India, we avoid sunlight. Okay. You just go to a resort. You'll find when the day becomes hot, 10 o'clock, 11 o'clock, all the white people will come out and they'll be lying on the beach and getting sunburned. Okay. That's the time we'll all go inside and we'll be, in the morning we'll go, evening after sun comes out only we'll come out. And you see whether I'm bluffing or not. That's a observation which I see. We don't want to become dark. We don't want to become thing. It's a human thing. In India, it's a natural tendency. Where are you going to get your vitamin D from? So the best thing I would advise is check your vitamin D. I'll bet you that 80% of you will have low vitamin D. And then take some supplement. One small capsule or one small thing you take, the vitamin D is taken care of. Getting it from food is very difficult. Okay. Zinc, on the other hand, you can get from food. You can get from dals, pulses, dairy, eggs, whole grain, shellfish. So many things are there. Very rarely you need a zinc supplement. I don't prescribe zinc supplements to anyone. You don't need it. You'll get it. If you are having deficiency, you can take it. Now, all the alternative medicine people will say, oh, you guys, allopathic, you fellows give all wrong medicines, you kill people with the thing, and that fad has now gone into all social media. Not only social media, the whole, all of India believes that every medicine we write is a poison. Every medicine we write is giving side effect. So I keep telling people, I didn't learn 50 years medicine to kill you with my medicine. I can kill you in so many other ways I want to kill you. Why should I give you a medicine and kill you? So our medicines are safe if you know how to use it. It's like a knife. If you don't know how to use it, you'll cut yourself. If you know how to use it, you can do beautiful carving with it, beautiful plastic surgery you can do with it. Okay. But these are all immune boosting foods, which our friends in alternative system will tell you about. There's nothing alternative about it. It's all we take. Turmeric, ginger, garlic, broccoli, citrus fruits, kiwi, papaya, green tea, spinach, yogurt, almond, sunflower seeds, and shellfish. These are the 14 foods which can boost your immunity. Okay. Why you think allopathic doctor cannot ask you to take spinach? I just told you green leafy vegetables are very good. Yogurt, excellent for a probiotic. Almonds, I told you nuts and seeds are good. I told you all this already. So these are all simple home things which can help you to improve your immunity. Now let me move to exercise. Exercise, the first statement is longer the belt, you're normally very happy. Prosperous man is going to put on a lot of weight, but the longer the belt, shorter the life. Remember that. Shorter the belt, longer the life. Okay. And if you have obesity, then it makes you more prone to diabetes, cancer, stroke, gout, gallbladder disease, osteoarthritis. So obesity is one of the worst for COVID-19. COVID-19 outcomes are worst in people who are obese. This has been shown again and again by so many papers. That's where exercise comes in. If you do regular exercise, you can reduce your sugar, cholesterol, LDL, increase your HDL, decrease triglyceride, blood pressure, weight, body fat, decrease insulin resistance, decrease stress, and prevent diabetic complications. So many benefits you get by doing exercise. I want every one of you to do regular exercise. You should not miss even a single day, unless something one night your sleep was not very good, so you're giving yourself rest for one day. Otherwise, 5 to 6 times a week, definitely you should do exercise. This is something I coined. I call it as a FAR principle, F-A-R, so that you remember it, how to do exercise. F stands for flexibility, like this, bending backwards, bending forwards, very important. Only then your joints, your muscles, everything will be in good condition. You will not fall when you grow old. Aerobic exercise, all of you know, swimming, jogging, walking, cycling, whatever you like, they are all aerobic exercise. You're burning oxygen, you're going from one place to another. Apart from that, resistance training is also important. You don't have to lift 50 kg weight or 100 kg weight and put a strain on your heart. Just take a 2 kg or 4 kg weight and then do with the dumbbells. If you're able to do your pectorals, your shoulders, your arms, your biceps, triceps, everything will improve if you do this. Resistance training you can do twice a week. Okay, aerobic and flexibility you can do every day if possible. Try to get 10,000 steps a day. Now everybody knows about the 10,000 steps because it is there on your phone. You just put it in your phone, in your pocket, and keep walking. Okay. How do you increase the steps apart from the exercise that you do? Whenever you make a call or receive a call, keep walking about. If I have a long room like this, when I get a call, I'll immediately start walking. I'll get 500 steps, 1,000 steps with that. Okay. Taking a dog for a walk, going with your family for a walk. All these are very good. Even in your office, walking about is very good. Next, moving to stress and anxiety. Stress reduction is very important. And this can be done through meditation, yoga, recreational activities, music, bhajans, dance, whatever you like. And of course, time management. One must live a life of moderation and do nothing in extremes. If you do anything in extreme, even exercise you do in extreme, it becomes a strain on you. If you do too much of dieting, and you lose too much of weight and so on. That is also bad because then immunity is going to go down. Everything in moderation you can do. Work-life balance is very important. Many of us are very ambitious. We want to do this, want to do that, we achieve this, achieve that. But if you don't balance your work and life, you're not going to be happy. Especially the first one to suffer will be the family. Okay. And there is no point in forgetting your family, your children, your husband, your spouse, or whoever it is. If you don't have time for them, your life is a waste. You'll never be happy. Okay. You may get awards, you may get this, you may get publications, you may get the increment, you may get good job. Ultimately, you won't be happy because you don't have the social support of your family. Sleeping is very important. Now, people think sleeping is a luxury, which you can avoid. Sleeping is the secret of immunity, And how should you sleep? You should get 6 to 8 hours of good quality sleep. Lowest is 6, highest is 8. Why highest is 8? More than 8 if an adult needs, there's something wrong with you, Either you've got obstructive sleep apnea or hypothyroidism or something you have. Otherwise, you don't need more than 8. Okay, that's why the range is given, 6 to 8. Less than 6 if you do, no, I can manage a 3 hours sleep, 4 hours sleep. No, there's no question if you're managing, you're also human. You're not a superhuman, okay? You will get sleep deprivation. Suddenly one day, one heart attack you may get because the body will be accumulating all that stress. So 6 to 8 hours of good quality sleep. Try to get into bed by 11 p.m. Now that also I put down. You know why? Because you can't get into bed at 2 a.m. and get up at 8 o'clock and say, I've got my 6 hours sleep. No, nature designed you to sleep early. Your chronobiology is set like that. You cannot cheat your chronobiology. That is why when you go to US, come back, oh, I'm jet lagged, I am thinking, because your chronobiology is completely upset. Okay, your melatonin is all gone. So you must try to get into bed. If you have a shift system, if you are working in a shift, something, that's unavoidable. It's an occupational hazard. I'm not talking about that. I'm talking about normal people who get into bed. 11 p.m., after 11 p.m., everybody should be in bed. And get up by 5, 6, whatever, and then do your exercise. That will keep you fresh. Yoga helps improve memory, concentration, relieving stress and anxiety, focus. Everything is good with yoga. So our Prime Minister has even declared International Yoga Day. So yoga, I think, is fundamental. Everybody should do it. If you want to remain calm, focused, balanced, yoga is very important. And within that yoga, I would say more than the exercise, the asanas, pranayama is very, very, very important. Okay. Now, about relaxation, everybody must have a hobby. You cannot be working. Okay. You must have a hobby, learn to relax. And the last one is very important. Find inner peace and spirituality. Spirituality is, I didn't say religion, I said spirituality. You need not even have religion. But we have spirituality, which is loving another human being, caring for another human being. Okay. Finding, empathizing with another human being, helping another human being, whoever that human being is. If you do that, you will find inner peace. If you don't do that, if you're just selfish, you don't want to help anyone, then it's not good for you. You will never be a happy person, and your inner peace will not be there. Then how will you get immunity? Inner peace itself is all disturbed. The mind is playing a very, very important role in immunity and infections and so on. The last one is, of course, controlling chronic conditions like diabetes, hypertension. You do all this, but your sugar is 400, then what is the point? You have to look after that. I just want to say, I've already talked about diet. I already talked about exercise. Education is very important, and medicines in the last pillar only I put. If these are the 4 pillars on which management diabetes is built, diet is number 1, exercise number 2, education is number 3. If you don't educate yourself, if I don't talk to you like this, you will not understand why the first 2 are important. And you won't know the importance of the last one also. Okay. Medicines are also important. If you have been told to take medicines, take it. Trust the doctor and then take your medicines. People are always suspicious of doctors now. I would say that's wrong. Trust, have faith in your doctor that they will do only for your good. If you do that, then everything will be fine. I just wanted to show you one technology, being a diabetologist, which some of you might have used or might not have used. This is a sensor, a small sensor, which is now freely available for the last 4 or 5 years. I introduced it for the first time in the world, incidentally. I think in 2015, I introduced as a first when I saw this instrument being developed, I took a promise from Abbott company that I'll be the first in the world to get it. They kept their promise, gave it to me. 2015 March, they presented the first one to me and said, here, you're the first one in the world, take it. So from that time, I've been using it in thousands, and I've published many, many papers on this. So what this does is you stick a small, like a carom board coin size, okay? Just stick it on your hand. Just stick it. There's no injection or nothing. Once you stick it there, it'll start recording your blood sugar on a minute to minute to minute to minute basis. And then it'll give you graphs like this. This is the whole day, day 1, day 2, day 3. This is 24 hours, starting in the midnight, ending in midnight. This is 24 hours. This gray area that you're seeing here is what the normal blood sugar should be. You can set it for whatever you want. For in this case, I think I've set it at 70 as the lower, 180 as the upper. It should not go above 180, should not go below 70. Ideally, it should be, say, 80 to 140. But I'm just saying up to that you can put it. Now, by wearing this, it will tell you on a minute-to-minute basis what your sugar is. If it crosses 180, it will become yellow in color. If it goes below, it will become red in color. So you can see red there. Now, this particular patient who came to me, and then it will tell you in the 24 hours, how much of the time is in target. The second column here is time in target. You can read that. Now, it should be 100%, obviously, but anything above 70% is okay. When this man came to me, it was 0%. 0% target, 0% target, 0% target. Time above target, time below target is shown in red, and time above target is shown in yellow here. Time above target is 100%. 100% of the day is out of control. Okay. Now, slowly I started adjusting his doses. His sugar started coming down. 19% got under control. Then 65%. Next day wasn't good. Next day 62%. Then it went to 99% on day 9. 100%, 91%, 74%. Last day you don't see, it's only half the day. Overall, 2 weeks he got only 47% under control because first 4 days he lost. So the average has come down. But you can see not a single low sugar, and what is 100% above target has come to 0% above target on 1 day and so on. So I told this man, I want to put one more of this because next 2 weeks, it shouldn't go low also, the way it is going so fast. Look at the next 2 weeks. Beautifully under control. Time and target 98%, 95%, 99%, 100%, 100%, 100%, 100%, 94, 96, 95, 100, 98, 100%. So almost 100. And now the 2 week average is 98%. 2% is below. Now the time above target is 0%. 0, 0, 0, 0, 0, 0, 0, 0. Now, if a man maintains or a woman maintains this kind of control, as far as COVID is concerned, they're like a non-diabetic person. Nothing will happen to them. Okay. It is, if you have that kind of a control like this, these are the people who are affected by COVID. Whereas if you have it like this, COVID will not bother you at all. Okay. So this is a very important thing. So to assess diabetes control, you can look at fasting sugar, postprandial sugar, HbA1c should be less than 7%, and time in range should be more than 70%. This is the time in range which I just showed you. So we got 4 parameters now: fasting, PP, HbA1c, and time in range. This is a new parameter which has been introduced. Vaccination, somebody already asked me when I started, should people with diabetes take pneumococcal vaccination? 100%. You should take pneumococcal vaccination. You should also take influenza vaccination. In one arm, you can take pneumococcal vaccination. The other arm, you can take influenza vaccination. Why should you take this? Number one, we don't have a COVID vaccine yet. The AstraZeneca one made in Oxford was supposed to be the best. Okay, and that's what our Serum Institute has produced. Yesterday, they stopped the trial. Somebody developed transverse myelitis due to that. They stopped the trial now. Now they're going to see whether what to do, how many people will develop side effects. We don't know all that. So while we're in a hurry to get the COVID-19 vaccination, they've not stood the test of time. Okay, and I would hesitate to take it now. Where risk of transverse myelitis is there, I'll hesitate to take it. But these are 2 vaccinations which everybody, it's been accepted now for years. ADA, WHO, everybody says take it. Because most people, if they develop a pneumonia in diabetes, they die due to that. So if you take pneumococcal vaccination, you can prevent pneumonia completely, bacterial pneumonia. Similarly, if you take influenza vaccination, there is no proof, but influenza also belongs to the coronavirus, as you know. So maybe 20% less effect you may have due to COVID. That's just a hypothesis saying. Even if it doesn't have any effect, still it will prevent influenza, which is very similar to COVID. At least one disease you will not get. You won't be confused whether it's influenza or COVID-19. So these are things. Influenza has been taken every year. Pneumococcal is once in a lifetime. If you take that injection, for whole life you're protected. So I would recommend all diabetic people to take that. Now, a few words about the treatment of diabetes and anti-diabetic drugs. Can all anti-diabetic drugs be continued? If symptoms of COVID are not there or it's very mild, yes, all anti-diabetic drugs can be taken. If severe COVID-19 symptoms are there, if you're admitted in ICU and so on, certain medicines you have to stop, like the SGLT2 inhibitors and so on. You should actually start insulin. Metformin can be continued. The risk of lactic acidosis is very, very low. Unless you are in a little serious state, then you should not take metformin. TZDs, they increase the risk of pneumonia and they produce fluid overload, pioglitazone. I would not give it at all. In fact, I don't give to any patient at all. This liraglutide also, there's been some doubt whether they should be given during this. Anyway, it is to reduce weight and all. Mostly, this is not a drug to be used. DPP-4 inhibitors are supposed to be very good, very safe. They're supposed to be actually better in patients with COVID. In MERS, it has been shown to reduce viral entry. Very safe drugs you can use. SGLT2, I told you, in severe cases, you should stop. Sulfonylureas you can take, insulin you can take, especially in severe cases. Hospitalized patients, especially in ICU, better to be on insulin. IV insulin, frequent blood sugar monitoring. You can also give it subcutaneous or using insulin pump. Therapeutic goals, I already told you. Time and range, above 70, HbA1c less than 7, avoid hypoglycemia. Insulin resistance has been reported after COVID-19. I have not seen this because I don't actively treat COVID-19 patients. They come to me after that only. But some of my colleagues who really treat them say, oh, Dr. Mohan, they need 200 units of insulin, 300 units of insulin. Because of the COVID storm and so on, the cytokine storm, they can produce severe insulin resistance. Ketoacidosis has also been reported in a few cases. Can COVID-19 precipitate new onset diabetes? Just now before I came, Pudya Thalamarai had talked to me and said, can you talk about this? I've just recorded something and sent it to them. They'll probably play it today or tomorrow. So I said in 3-4 ways, COVID can actually produce diabetes. Number one is by stress and anxiety, depression. So that is one way in which it can produce. Second is irregular lifestyle, unhealthy diet, lack of exercise. You'll put on weight, and obesity is another factor. Third is due to, I've not added it here, high dose steroids, dexamethasone, used during treatment in the ICU. That can produce diabetes. I've seen already a couple of cases coming. Sir, I didn't have diabetes and I got COVID. They gave me these steroids and now I've got sugar, So it can come due to that. Last, this is not proven. Direct viral damage to pancreatic beta cells. That could be yet another mechanism, but that is not proven yet. The others are all proven. So these are some of the summary of the recommendations for diabetes and COVID. Outpatient care, sensitize patients regarding better diabetic control, optimization of current therapies, not to discontinue treatment, diet, lifestyle, exercise, telemedicine to be used, and then inpatient care, patient care, plasma glucose monitoring, pH, the usual stuff. Okay. Now, this is a very short study which we published very recently in Diabetes Technologies. We wanted to see whether after the lockdown, what happened? Because everybody predicted HbA1c will go from 8 to 16 to 12 and so on. So we did a study. We went back to about 3,000 of our patients across India and collected data from them. These are all the places where we studied. And this is how we get the, I'm not going to go into this, but this is actual telemedicine that we do. Patient contacts, dietitian takes the history, we do the phlebotomy, take the samples, consultant sees all the records on the electronic records, and then the medicines are delivered to the patient. And this is all the home services, how we go and do. So first question we asked was, did you try to see a doctor? Look at this. Only 13% of people actually tried to see a doctor during lockdown. I had expected all of them to knowing so much about diabetes. At least they would have tried. They didn't do it. But one good thing is they started doing more SMBG. They started getting scared. You can see that at least once a day, overall, SMBG, self-monitoring blood glucose, 15% used to do before lockdown. During lockdown, 51% started doing. They started checking their own sugar. They got scared. They didn't want to go and see the doctor, but they started doing their own sugar. Okay. Now, this is very important. Look at the HbA1c. HbA1c before lockdown is 8.2. After lockdown is 7.7. It's come down in our patients. And the patients are good. They've been following diet, exercise. They're at home. No stress. Working from home. No pollution. No stress. No deadlines. So many things came down. So actually the health improved. This is a very big surprise even in the international scene. Now from China and other places also they're saying the same thing. Okay. And this is just to show that diet and all, diet didn't change, but physical activity went down. Look at this. The decrease during lockdown, 24% of people could not do exercise. Okay. And then teleconsultation, many people said their problem. We are not able to express all the problem. We are unhappy. It's not as good as consultation. We want the touch of the doctor over the phone. We want to say something after putting the phone down only we realize this. So teleconsultation, when you ask them, will you continue teleconsultation later? They said no. 50% said we will want to come and see the doctor in person. Okay. So this is the conclusion. Acceptance of the technology was low. Patient satisfaction was high, but they said we will not continue to do that. We want to see the doctor. Now, this is, I just wanted to tell you that, we are on social media. For those of you who want to know more about COVID, about diabetes, and so on, we have in all the channels we are there: Facebook, Twitter, YouTube, Instagram, LinkedIn. All this I got into after lockdown only. I had no other work. So I started going into social media and started making a lot of videos. That's how that other video and all that came, the immunity video and so on. So if you want to, just type Dr. V. Mohan in Facebook, Twitter, YouTube, and you'll straight away get linked to me. DRVMOHAN. That's all. If you do that, you'll get it. And these are some 4 of my popular videos. There's one on metformin. Somebody said that, in the FDA, there was some contamination found with some companies. And they said NDMA levels are high, it will produce cancer. Everybody started calling me, should I stop metformin, stop metformin? So I said, this is contamination. 60 years we are using it. Don't stop it. 3-minute video I made on metformin. 1 million people saw it. Today, I think it's 1,300,000 people have seen this video in last 2 months. Okay. And then I made one on this AGP, this patch. More than 1 lakh people have seen that. Then this is a man who, after he crossed 100 years of age, is my old patient. He said, can I talk something? I said, yeah. Then we recorded for 1 minute, 2 minutes. He said, I'm not old. I'm young. Please don't call me old. I'm a young man at 100. I've got many more plans, he said. So it's very good. That we put a picture of him tying this thing on his wife. That went completely viral. 17,000 people liked it. So what I'm saying is a very powerful way of connecting in social media, connecting with people. Okay. So I'm going to stop here in the interest of time, and then we can take questions. There's something which is stop sharing. Yeah, stop sharing. Okay.
Yeah.
So we have some time for questions.
Thank you, Doctor. Yeah, thank you, Dr. Mohan. That was indeed very nice. You walked us all through from how to eat healthy food to how to exercise, what medicines to take, and you really clarified a lot of this misconception about this COVID and the scientific research which is getting published. That reminds me of that study which came from UK. There was a statistical misinterpretation, and they said smoking actually helps in fighting against corona. That was the initial summary report which was widely reported and said, if you want to prevent corona, then you start smoking. Then they did the sub-analysis and they found that it was indeed not the case. So that is the same thing I think we found with this thing also, the diabetes and COVID, because this report, what you're talking about in Puducherry, appeared in the papers yesterday here. And that has now been picked up by all the media.
The edition came today, yeah.
Yeah, Dr. Mohan,
of Indian foods, yeah, correct. Indian foods, yeah.
Work, such a lot
Thank you.
of
You have a very
work
good nutrition team.
Item of many of you for information.
Yeah. Correct.
Yeah, it's quite strong. Yes. Incidentally, I'm just trying to Google out. Yesterday only, the Lancet published a paper on the same title on which you talked. The September 2020 paper.
Okay.
On the COVID and COVID-19 in people with diabetes, understanding the reasons for worse outcomes.
Oh, okay.
And I was really yesterday evening. It came in the my mail.
Oh, okay, okay.
It was such a coincidence.
Please forward it to me. Yeah. Please forward it to me. I'll see it. I haven't seen it. Okay.
Yeah, I'll forward that. Yeah, certainly. And it has very clearly said, one is about the direct beta cell destruction by these COVID-1. They have said. Then some studies they have quoted. And a related article in that one I saw, which really moved, and everybody will be think over. This we are maintaining a social distance of 2 meters, right?
Yeah. I think you're muted, sir. You're muted. Yeah, now you're okay. Yeah.
Yeah. How far the cough drop rated by any individual? They have done a wonderful study and they have found that micro droplets will go and lodge even 5 meters away.
Correct.
Then I was wondering
that came little earlier. That is the reason why if suppose you're in an elevator with somebody had COVID and then left, still you can get infected because it can still be there. So that is where, see, if you wear a mask, it doesn't matter it's 2 meters or 5 meters, don't go beyond your face. So you won't infect others, others also cannot infect you. So both ways you are protected. That is why if both people wear a mask, it is shown that the risk of infection goes down by more than 90%. You have to be really unlucky to develop that. So yes, this aerosol transmission is there, and that is why mask wearing becomes even more important.
Okay, thank you.
Okay. Sir, there were few questions which had come
Please
before
go
the talk itself. I think most of it you had answered. There was one question on the correlation between DEXA use and COVID. Like, has it really exacerbated the diabetes in patients with COVID?
Absolutely.
Dexamethasone use.
Yeah, absolutely. Because the dose of dexamethasone used for treating COVID is very high. It's not a small dose, it's a huge dose. So it will be very surprising if somebody's sugar didn't go up with that kind of a dose. But then for life saving, you can always give it. But suppose you're borderline diabetic or already diabetic, the sugar can go very high. So you'll have to give insulin at that time to match it. And if you're not prone to diabetes, maybe after the COVID, when you come out, it may settle down. I've seen one such case who came with 400, 500 blood sugar. He was actually in one of the TV channels he was working. So he came with 500 blood sugar. He said, "Kandipa kadaiya, sir, I didn't have it. இது கொடுத்தாங்க dexamethasone கொடுத்தாங்க அதுக்கப்புறம்." So I said, "Okay, now you take insulin. நான் பார்க்கிறேன் after a month, maybe it will settle down. Then maybe we can withdraw it. The effect is still there. It must have given a big beating to your body, but we will see." So dexamethasone definitely can increase. I've seen already 3-4 cases post dexamethasone.
Thank you, sir. There's one question from Dr. Anis, who would like to ask about how to manage pregnant women in diabetes during COVID. So is the management any different or?
Yeah, so I think he's asking in general. So Anish, during pregnancy, insulin is always the safest. Metformin is very popular. People are using it, but it's weak. And so during pregnancy, I still use insulin in 95-98% of patients. If somebody doesn't want, then I may give metformin. So safest during pregnancy for all these years, and it's only for a short period, few months, and the mother will be definitely willing to take it for the sake of a child. So I would say take insulin. And during pregnancy, of course, all other drugs are contraindicated. You cannot take DPP-4, you cannot take SGLT2, you cannot take pioglitazone, you cannot take metformin is only one that is given. Even sulfonylurea, there is a little doubt regarding that. Insulin and metformin, these two you can give. I would say mostly insulin would be needed for everyone.
So one more question. You were saying that SGL2 inhibitors should not be used during this COVID. That is
if it is severe,
yeah. So why is that statement being made?
So SGLT2s are very powerful drugs, but they produce dehydration, number one, electrolyte imbalance, drop in blood pressure. So even outside COVID in old people after 65, 70, we don't use it. It's a very powerful drug. And it can suddenly produce, imbalance, sodium, hyponatremia, a drop in blood pressure. All these are very well known. Apart from euglycemic ketosis, which it produces, plus urinary infection, genital infections, all those things are there. So in an acute condition, when somebody is coming, why give that drug? You keep it for 2 weeks, treat with safer drugs, and afterwards, when they're all right, you can reintroduce it after that. That's not the time to try it. Having said that, there is a trial going on in US on SGLT2s in COVID. Dapagliflozin is being tried. They'll try everything there. So we'll wait for the trial. If it shows surprise is very good, then we may use it. But right now, all guidelines say don't give it during that time. You're talking about 2-3 weeks time, at that time to stop.
The other question which is there is it's very impressive to study on how people reacted to telemedicine consultation and what it is. But from what we are seeing now, sir, most of the hospitals are suspending OPD services, including government hospitals, and the PHCs have become testing centers. So what is the impact of NCDs, especially diabetes, in the population. Like the people who are committed to come to Mohan's clinic are
Yeah.
obviously more committed to controlling their health and their diabetes.
Yeah.
But what about the common Munusami and
Yeah.
who are there?
Let me answer that. See, this was done. 85% of people, when before COVID started, also we were trying telemedicine. That time, 10%, 15%. Nobody likes telemedicine. They want to come and meet the doctor. During COVID, people are scared. During the lockdown, we are completely closed down. We didn't even allow. First of all, government is not very clear whether for routine care you can actually give it. Then I talked to the health minister and convinced him. I said, sir, in parliament, in assembly, you are saying 3 times you have said diabetes is a big killer. Then why should we not treat diabetes and bring it down? He said, correct, you all go ahead. This. And our association also wrote. Then they allowed us to open the diabetic clinics. But even then, people are scared. Okay, so they were not coming. So we went to those who used telemedicine. We did thousands of telemedicines. So we did the telemedicine. Then asked them, after this is over, now that you've got a new normal now, do you want to just continue this? You stay at home. We will come, take the blood. We'll have everything through telephone. You don't come to a clinic at all. You don't have to wait. You don't have to. That 50% of people said, yes, we don't mind, especially the older people. They needed support to come. The children have to be there to bring them. They said, idu nalladha irukudhu billu. But 50% said, no, we don't want all this. This is only temporary. We are just waiting for a thing. We are missing your touch, doctor. We want to see you. We want to talk to you. It is not the same as talking. We want to see your face first. I said, I'll go do it on video. Adella patha doctor. We must come. நீங்க தான் பிபி எடுக்கணும். நீங்க தான் என்கிட்ட சொல்லணும். அப்பதான் we'll get the thing. They have that faith in the doctor. So 50% of people, 50% said no, 50% said. During the lockdown, there is a different issue. When you can't go to the thing whether that is going to work or not. We are talking about post-COVID. Now everything is opened up now. Unlock and all has come. Now, should we continue only with telemedicine, or we should see one thing about telemedicine is you can decrease the number of visits. I get a lot of patients from Calcutta, this, that. I can tell them once a year you come, 3 times I'll do telemedicine with you. And then after that you come once a year. Otherwise, every 3 months, 4 months, they'll be catching a flight and then coming from there. So telemedicine has its advantages, no doubt about it. So now that it's legalized also, it definitely is useful.
The technology has changed the way in which we practice medicine, so that is what we can infer. And also know that you spoke very nicely about the doctor's touch. That one of those nice TED talks which Dr. Abraham Burgess from Stanford University
about the touch of the
about
examination, clinical. He's one of my favorite doctors. He's really good. Cancer.
Yes, sir. That's the way in which it is going. It was very nice having you here today, sir, and thank you for answering all our questions. Yes, sir.
Sir, you're muted, I think.
Muted, sir.
You're muted, sir. No, again muted. No, it's okay.
I have 2 things to ask. One is, this is a stressful.
Yes.
School of the patient on oral hypoglycemic agents. In between, after insulin, give rest to the beta islets of Langerhans. Okay. Then, after the stress is over, then again going back to oral hypoglycemic agents. How do you suggest this idea is number 1? And second question is, I distinctly remember I had seen Dr. Mohan's rice packets that time when I visited. Low glycemic index. Yeah. Because I was very keen. Can you just
about both I'll answer. I think what you've said about the giving rest to the pancreas is a brilliant idea. And whenever there's glucotoxicity, lipotoxicity, when the tablets are straining and not able to control, giving about 1 month insulin gives very good rest to the pancreas. It allows the beta cells to regenerate, to produce more C-peptide, and they respond much better. The power of the tablet increases multifold if you do that. People are scared, thinking that it'll become lifelong addiction to insulin. They use all these words. But that's not true. And I published several papers on this now to show that just a short course, even at the time of diagnosis, if the HbA1c is very high at the time of diagnosis, their beta cells will be in very bad shape due to glucotoxicity. 4 weeks of insulin, that's it. 4 years later, they're getting the effect of that. It's dramatic. It's really, really good. So we must only where it's needed. If the HbA1c is only 7.2, you don't have to go and give insulin. But HbA1c is 11 at the time of diagnosis. They'll do very poorly if you give them just tablets and you don't support them. So that is one thing. About the rice, yes, it is true that the latest paper published just now, as I told you, is this large incident diabetes and white rice paper, which we published along with Dr. Salim Yusuf from Toronto. But this has been there for a long time. We've been showing this association rice and thing. So we first produced brown rice, then we produced this high fiber rice in collaboration with some people from the agricultural side. We produced this rice, but right now we are having some quality issues with it. See, what happens is this rice mutates after some time, and then suddenly the fiber content goes. It's very difficult. It's grown, no? It is not manufactured. You have to grow it, and when you grow it, after the first, second, third, fourth time, the quality kind of goes down. So we found that last 6 months, 3 months, it was first 3-4 years was very good. Now we are looking into alternatives. Actually, I'm trying to work with the Tamil Nadu Agricultural University, trying to see whether we can work with them. I've talked to the Vice Chancellor and said, can we collaborate and find, also millets and other possibilities are there. But definitely lower glycemic index and higher fiber is what we need. And that will definitely help to lower the postprandial sugars and the insulin levels.
Thank you, Mohan.
Thank you. So maybe we'll wind up now. It's 4:05 now. So
yeah,
have another program in
much,
5-10 minutes. So
yes, sir. Thank you very much, sir. On behalf of AVMC Scientific Society and VMRF, I thank you for delivering this wonderful lecture. We'd be sharing the chats of the participants with you, sir, along with the participants list. So you can actually continue the discussion if you want with some of them.
Sure.
Thank you. Thank you, sir. And
thank
I would like to
thank you, Professor Kotur, and send me that Lancet article you said. And also
right now,
forward to more interactions now that you're closer to us. We'll try to have more interactions with the college. Okay? And the university.
Thank you, sir.
All the very best. Thank you, and wish you all the very best, and all of you stay safe. Look after your families and see that we quickly get out of this COVID, because we've got a lot of other work to do. And incidentally, you asked about NCDs being neglected. I wrote about 3 weeks ago, there's an open page in the Hindu. I think Sunday it was. Sunday, 3 weeks ago. So I've said COVID should not lead to neglect of NCDs. So our NCDs sidelined by COVID. That was the article I wrote, and a full article I published on that, saying how important it is to treat kidney disease, hypertension, cancers, diabetes, and even TB and other disorders. We should not forget all of them. Everybody is taken in by COVID. They forget everything else. COVID will come after 6 months. You may not even have COVID, but these are the real killers of India. So that we should not forget. The point is well taken. Thank you. Thank you so much.
Yeah. I would like to remind our participants that we'll be sharing the YouTube link for this session with all of you, along with your e-certificate link. And to remind you, the next week we have an interesting event in AVMC. We have an international conference on biomedical sciences, how basic sciences in research. That is the topic. So in that, we would be having the FFF webinar is embedded in that topic, and we will be Professor H.P. Kincha, who was the chair of electrical department in IISc and who is currently the chairman of NPTEL. He will be addressing about capacity building of research in the institute.
I'll take leave now. Another 5 minutes. I have another meeting. So thank you. Carry on.
Thank you.
Okay.
That is the information for the participants. So please do join us next week also to listen to another interesting talk. This is Dr. Mahalakshmi, Dean Health Professions Education from AVMC, signing off on behalf of the Scientific Society of AVMC. Thank you very much. We'll see you again next week on Friday, friends. Bye-bye.